2 new drug injection sites are open now in New York City, hoping to prevent overdose deaths. The nation's first overdose prevention centers are allowing users to inject drugs under medical supervision. The already hefty number of drug overdoses have skyrocketed since the beginning of the pandemic. In 2020 alone, more than 90,000 people died from drug overdoses across the U.S., 2,000 of those in New York City alone. Our affiliate in New York talked with a participant of the program where people are already waiting outside to get into the clinic.
You can get high without the chance of killing yourself. Get the needles here, clean needles. I get the smoking pipe here. I wash my clothes here. I said caseworker here.
Here to talk more about this is NewsNation anchor Rudabeh Shabazi. Now, on the surface, it's easy, Rudabeh, to say, what in the world? Wait, they're doing what? They're allowing them to go somewhere and inject drugs. But what's the purpose? What's the reason behind it?
Well, they're saying this is backed by over 100 sites around the world. They've been doing this in Canada, in Australia, and around Europe. They say that they have 30 years of research in the books that demonstrates this works. And they say the main goal is to curb drug overdose deaths, which have been skyrocketing, as you just mentioned.
We just set a
if you
record.
think about just in New York City alone, 1 person every 4 hours dies of an opioid overdose. So they say that's the main concern here. They say that it works. They provide clean syringes. They monitor people who go and do drugs. They don't provide the drugs. They allow people to go there and do it. It's kind of a BYOD, if you will. So they provide syringes, and they have people there, and they have Narcan and other things there to administer in case of an overdose.
Well, this is another good point, because you've got a very up close and personal opportunity to reach these users and these addicts and hopefully maybe get them help or get them off of the drugs. They're there, you can do it.
And that's the other thing. That's another thing they try to do, is provide them resources to get off drugs, drug prevention resources, counseling, etc. So they do all of that. The health commissioner says, you know, this is backed by more than 30 years of research. They say that this will actually also curb drug use in public places, which the city and the state, they say, has been asking for. They don't want to see people overdosing in the streets and leaving needles around in the streets.
Which is where most, the homeless stories that we've all covered, you know, they want to stay in their tents on the streets. They don't necessarily, I wondered, will they go to a facility like this to shoot up in public at a place? And the answer, based on the lines anyway, is yes. So what are critics saying?
So critics, we actually have sound from a critic, a congresswoman who doesn't want this. They say this is essentially a government encouraging people to go and do drugs, that these are creating hubs. And if you look at the one where we just saw the lines of the people waiting outside, there's a school right across the street. So do you want your kid going to school right across from this? They say that this is encouraging illegal activity. It's encouraging drug use. It's not prohibiting drug use and preventing drug use.
But it's a very emotional issue. You can tell. I mean, when you hear some of the people who are involved, especially the supporters who see where this is working, they get sort of choked up and emotional about it, because it's a viable alternative to what we're seeing on the streets, which is thousands of people overdosing and dying.
Yeah, and they say that it really is the bottom line, that's what they need to, be focusing on. We actually have sound from one of the directors at the center. Take a listen.
It's been really hard on the staff and the participants over the years to lose so many people unnecessarily. And I just think that we think of them and we remember them when we opened our doors this morning, all of the people who didn't make it.
So you see how emotional they get. Those are the people who see this firsthand. They also have testing for fentanyl, which we know has been a huge issue. It's been laced with other drugs. If people don't even often know that they're, ingesting fentanyl. On the other side, we have Representative Nicole Maliotakis from New York, who says this is a terrible idea. She's been trying to get the Justice Department to intervene and curb all of this. But as you know, de Blasio is termed out. This is his last year in office, and he's been trying to effort this since 2018. So take a listen to what she had to say.
We need to fight this issue at the core of the problem, which is where are the dealers coming from and where are the drugs coming from? And we know the answers, but the city and the state are not taking action to resolve this, and neither is the federal government.
So that's where we are. We have both sides of the story, a controversial issue. Of course, if your kid is going to school across the street, you might not like it. But if you're someone who sees people overdosing in the streets, you might think it's a good idea. All
right. But it's open either way today with long lines in New York City. Rudabeh Shabazi, thanks for the time.
Thank you.
Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.